Change could be coming after a family tragedy first shared by CBS 4's Brian Moss. A young woman is left with brain damage after cosmetic surgery. The facility she used was unregulated, and there are many more just like it.
Since Brian's report, State Senator Larry Crowder introduced a bill calling for state oversight. And as Brian found out, families say it is past time.
Never did she complain about anything.
That's how Gary Cornelius remembers his mother, Virginia. He's still reeling over her unexpected death, claiming this Rocky Mountain Cancer Center was unprepared when something went wrong during one of his mom's radiation treatments in 2018.
Radiation therapist looks up and down the hall frantically. We could tell something wasn't right. And she's yelling, "Help me, help me, help me." Takes off running down the hall.
Since the center was next to a hospital, the family assumed it underwent state inspections. Did you think that was regulated by the state or some kind of a health authority?
Oh, absolutely I did.
It was not. Virginia Cornelius died that day of what the coroner would rule was heart failure. Her son believes her death could have been prevented if the facility had been conforming to state regulations and held to higher standards. He is not alone.
We're all waiting for you. We all love you so much.
Lynn Pham's 18-year-old daughter, Emmeline, suffered permanent brain damage last summer during breast augmentation surgery at this plastic surgery office. Her family filed suit claiming the office-based surgical center fumbled their response when Emmeline suffered cardiac arrest while under anesthesia, waiting hours to call 911.
She's not conscious.
That facility was not licensed or inspected by the state either. David Woodruff represents Emmeline and her family.
It's a dangerous loophole in the law that surgeries can be done in an office-based setting like this.
The state health department regulates other facilities like hospitals and nursing homes, conducting inspections, investigating problems, and penalizing facilities that fall short. But medical offices are exempt. Randy Kirkendall with the state health department.
Would you go to one of these places?
I would consider treatment in non-regulated facilities, but I would absolutely do everything I could to find out what the history of that practitioner is.
Exam room that I work out of most days.
But some plastic surgeons say a lack of regulation keeps prices down.
They makes those operations cheaper for the patients, more convenient for the patients. Unfortunately, bad outcomes happen. But does that mean that having the state come in and regulate that fixes that problem? I generally would think no.
But some disagree.
This has to be the hardest thing. I will have to say any parent or anyone could go through.
I'm Brian Moss, covering Colorado First.